So may I have your attention, the esteemed faculties and delegates? I would like to take a few moments of your time to introduce myself and the distinguished faculty members of this session. A very good afternoon and a warm welcome to all the dignitaries present over here today. I am Rituparna from Clarinet, serving as the allocation assistant to ensure a seamless experience. Clarinet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Clarinet serves as a digital partner for this online event hosted by the NNF Gujarat. And the focus of today's session is lessons from expert on zero separation. Now, without wasting any further minute, let's begin today's session, for which I would like to invite Dr. Kunal Lahiya, sir, the Honorable Secretary of NNF Gujarat State Chapter, to start the event today with his enlightening words and for the further coordination. So, over to you, sir. Kindly proceed with your talk.
Thank you so much, Ritu. So today we are having, since we know this month, we are having a KMC celebration day. So we'll be doing a lot of activities related to KMC day. One of which would be preparing KMC reels also. So we have sent the emails and brochures to all over the places. We request everyone to kindly make reels and send it to us. You have to fill the Google form and send it to us. And as a part of this activity, we are fortunate enough to have the mother of the KMC, Shashivani madam, with us. So without further delay, I would request Shwetal ma'am to say a few words. Ma'am, you need to unmute yourself.
Thank you very much, Dr. Kunal. As Dr. Kunal said, that this entire month of May, NNF Gujarat will be involved or engaged with the activities related to awareness, creating awareness for KMC among the community and the medicos as well as the paramedics cohort. So I am really feeling proud to welcome Dr. Mani madam. Madam is indeed what Kunal has said, mother for KMC in across India. When I am much fortunate that when it was started in 1998, I was there as a resident and I have witnessed the pilot project with the passion madam has taken up with Dr. Alok sir, our senior. And thereafter, I have seen entire journey of, I have witnessed some of the, wherever I was possible to be with madam, I have seen the way she propagates, she passionately works for kangaroo mother care. And thereafter, is the way the AIMS and PGI Chandigarh or Premier Institute has also taken up. And it is already a proven thing across world. It is a globally proven thing, and this intervention has a lot of rewards. And hence, I wanted that in the expert talk, the first session has to be from the madam who is like, when I listen more and more, I get enlightened about the kangaroo mother care. And I was fortunate that madam is in India, and she immediately she willing. I mean, with so much of busy schedule, madam has to leave for US on 13th, and so much work she has. Still, she agreed. Okay, I'll take up this expert talk. Thank you so much, madam, for agreeing. And in fact, NNF Gujarat will be obliged often and often to have you as a expert talk on kangaroo mother care. Thank you so much, madam. Over to Jatin.
Good afternoon, everyone. I don't think we need any introduction for Professor Vani Madam. Still, just in a brief, she is teacher of many of the students all over India, and I was also I've done my MBBS in BJ Medical College. When I joined the BJ Medical College as MBBS student, she was about to leave, but we have heard so many things that it is very small introduction I can only give. She is managing trustee of KMC Foundation India at present. She was past president of NNF India, Indian Academy of Pediatrics, and Gujarat State and Ahmedabad City chapter. She worked with PS Medical College Gujarat and has published many articles and winner of many accolades like Lifetime Achievement Awards of NNF, AOP Gujarat, West Zone, IIP Neonatology chapter, and many others. And as Kunal told, she is actually a mother of kangaroo mother care in India. Now over to ma'am. So you can start with the lecture, ma'am.
Jatin, you will be scrolling the slides.
Right. Yes, ma'am. He will be doing the slides.
Okay, fine. So, because Madam will say next, and you just keep on scrolling the slides. Okay?
Yes, I'll do it,
Ha.
ma'am.
Okay.
Thank you very much for the very kind words. And Gujarat NNF is my personal organization, I always consider. So all the activities are our activities together. And they have chosen a very relevant topic, which is going to means we are trying to change the mindset of all the persons who can offer kangaroo mother care. Initially, we started only with those who can offer it in the hospital for stable, low birth weight, and preterm babies. From that, now there is gradually shift to many other areas. The scope is expanding, and today we are talking about zero separation. That is a very, very needed human approach to the care of the newborns, including the small and very preterm babies also, and even for the sick babies also. Initially, in our good faith and knowledge at that time, we thought separating the babies and then giving them special care will have many advantages. But now, with the advanced knowledge and the experiences, the paradigm shift is happening, which we will learn now. So, zero separation, embrace the magic. That is the topic given, and which is we are going to talk about the loving hug, how to achieve the best as much as possible between the mother and her baby, and what are the implications. Next, please. Now, current thrust for the newborn care, as all of you know, it is not mere survival, but an overall well-being and thriving with good intelligence, love, and good quality of life. So somehow surviving the babies is not our goal, but we want them to survive, but survive with all the best possibilities in the life, potentialities in life, develop to the best. And as Dr. Meherban Singh has very rightly put, survival of the newborn should be an asset and not a liability to the society and nation. Liability in the form patients, babies might be born with many neurological deficits and mental handicaps also, even behavioral problems and so on. So even that should not be there. So the baby should survive and be an asset to the community. Next one, please. So in the first section, we will quickly deal what is this, why we should have zero separation of mother and her baby, why it is being strongly recommended now, and what is the neuroscience of zero separation. And in the section 2, how we can try to achieve this in our clinical care, how we can interpret the recent knowledge in our clinical care. Next one. So when we are talking about neuroscience of zero separation, the current method of care of small and sick newborns, as I already mentioned, is based on routine separation of baby and mother. And it is not only for the small and sick babies, even the normal newborns. Nowadays, we try to separate them without any justifications, valid justifications. For example, just because the baby was born with meconium aspiration, because the baby is born of cesarean, because the babies are twins, and all such excuses we take up. Of course, as I said, in very good faith that we want to continually observe these babies, catch the problems early, and manage them so that they can survive well. But now the same concept is getting a change. And the new knowledge does not justify separation and makes a strong case for zero separation. That is, not to separate the babies from their mothers as much as possible. We try to find out within our source and within our resources how best we can keep these babies and mothers together. And that problem especially posed a problem during the recently changing COVID era with due infection prevention core measures. We want to keep the babies and mothers together and not to separate. Otherwise, that was one of the justifiable excuse we had for separating the babies from the mothers. Next. Now, today's care of the very sick babies, very small and all the high tech interventions. Yes, they can give all the best possible help to the baby, but one major thing is lacking, and that is the mother's affection, which offers many more advantages to the baby, along with the care and the equipment. Next. And the same thing, even when the baby does not require that care, we try to give the same womb like care to the baby by keeping it in flex, keeping it in a nesting position, and warmth, and all the developmentally supportive aspects of the care to the baby. But now we have realized it doesn't replace mother's hug, embrace of the mother. Next. And as we find, and these slides I have borrowed from Dr. Niels Bergman, who is doing a lot of research in the newborn brain development and particularly zero separation concept. And he has allowed us to use this slide. Whenever a baby is under the incubator or warmer, for example, for whatever justifiable reasons, the baby is exposed to a lot of strange sounds, scary smells, bright lights, and moreover, the baby feels unsafe. The baby's body also stressed, the brain also stressed, and it leads to many other harmful effects which we realize later on. The baby is in a hypermetabolic phase. Naturally, the demand for the energy expenditure is much more and leads to a compromised stage right from the beginning. Next. When the baby is separated from the mother, infant's brain works in stress mode, as I already alluded to, and that releases stress hormones and stress neurotransmitters. They stop and delay the normal brain development. It impairs the cognitive and self-regulatory development of infant. So many well-proved experiments have given justifiable evidence for this concept. Next. And separated babies cry. This is another science which is now getting a lot of attention. In earlier days, we used to think a good cry from the baby is a good indication for the lung expansion and oxygenation, and it is very good for the baby. Yes, a few seconds of good cry, it is accepted, but not always required. So now they have found out that modern neuroscience does not approve this cry. Cry reduces growth hormone, increases the cortisol secretion, and that cortisol enables survival at the cost of extra energy spending. And that is why hypoglycemia is very common in low birth weight babies and very preterm babies. In non-separated babies, this energy is conserved and that is available for the development. Separated babies, their quiet sleep is also reduced. So stress is increased, sleep is reduced, and autonomic pattern is similar to that of a threatened or an abused baby, naturally hypermetabolic phase, high demand, high energy demand, and so many other adverse effects. Many adverse reactions, including lowered immunity and poor quality of survival. So zero separation is biologically normal and improves the quality of survival. I'm just giving you a summary of the findings here. Each of the statements can be justified with lot of other experiments. So non-separation is the most appropriate developmental care model for all the infants. It can be applied immediately to all the healthy term and even preterm newborns. Being with mother and in skin to skin contact, infant's brain is working in a safe mode, not in a stress mode, and promoting optimal development and functioning of all the brain areas is possible now. It prevents increased pain, prevents intensive stress, prevents depression due to separation, not only in mother but also in the baby, and there are many other reasons. Next. So, let us understand a little more about this stress. This is the UNICEF declared document. In the babies in a developing brain, there are three stages of stress. One is the immediate required short term positive stress. Next one is tolerable stress. And third one is the toxic stress. We will quickly go through it. So, positive stress is a moderate, short lived stress response. And that leads to brief increase in the heart rate, blood pressure, or mild changes in the stress hormone levels, such as cortisol. And these are all easily reversible stages. And the precipitants may include any discomfort to the baby, external stimuli, tiredness, hunger, thirst, and all such minimal stress inducers. And it is found that it is an important and necessary aspect of a healthy development that occurs in the context of stable and supportive relationship between mother and her baby. Next. Next, please. Next, we have what is known as tolerable stress. And here the precipitant factors are absence of mother for some time, painful procedures, harsh lighting, loud noise, and so many developmentally harmful effects which may have. And this can disrupt the brain architecture. But if they are buffered by the supportive relationship, and that adapts the coping situation, and this is again a reversible because it occurs within an acceptable time limit period. And it gives the brain an opportunity to recover from potentially damaging effects. Next one is the toxic stress. This is what now we want to prevent as much as possible. And that is very commonly accepted, and a lot of change in the conviction and competence required and mindset needs to be taken. Strong and prolonged activation of the body's stress management systems in the absence of the buffering protection of adult support. That is, which is given by the skin to skin contact on mother's chest, or some substitute or surrogate also can provide this, and that can mitigate this. But if this buffering is absence for a long time, like continuous absence of parent or any interventions which are done, say for example mechanical ventilation, for a long time, or procedures which are not buffered by support, all that can lead to a chronic stress, and that is very toxic to the developing brains. And prolonged activation of the stress response system, it stimulates excessive cortisol and it disrupts the brain architecture and other organ systems. Next. So when toxic response occurs continually or is triggered by multiple sources, it can have a cumulative toll on an individual's physical and mental health, not only for immediate short time, but even for a long time. And this is the situation which is very often happening in all our NICUs and even SNCUs sometimes. We think by keeping the baby and mother separate, we are giving more relaxing time to mother, and we can closely observe the baby and catch the problems earlier. But that is not good for the baby, as it is borne out by the recent experiments. And in persistent strain, stress, changes in the brain architecture occur. All of you know when the baby is born, a lot of neurons are produced and they do not change much. But the synaptic connections which develop, lakhs and lakhs of synaptic connections are there at the time of birth in a term baby and even in preterm baby. Those synaptic connections which are stimulated through the various sensory inputs, they persist. And those which are not stimulated, they die off. And the more the synaptic connections persist, the more they lead to the behavioral changes and the more they lead to the cognition development and other neurodevelopment, neuroprotective factors. The moment toxic stress occurs, they are all not stimulated and withered away. In the next slide also you will find the same thing which is seen from the rat experiments, and they say the same thing is happening when the baby is incubated. So when the baby rat pups are separated from their mothers, they become distressed and they show more vocalization activity, less thermogenesis, less behavioral activity, and so on. I won't read the whole slide. And the same thing is reflected when the baby is separated from the mother and kept under a warmer or incubator. The same conditions are happening. Next. So brain architecture is affected, and earlier the brain architecture is affected, it affects the later complex development also. They say the basic of the developmental structure should be well organized so that later on the complex developmental structures can build on this. And that initial few phases, few days in life, if we are missing it, sorry, then the initial basic neural structures, they don't form well, and then they lead to much complex development later. Next. Another one parameter, just a quick review, then it is the oxytocin, which is the main hormone, which has been implicated with so many benefits or harms that are occurring following initial skin to skin contact. And it is not only just mere superficial skin to skin contact, it is actually the loving embrace of the mother and her baby. And that stimulates not only oxygen, but many other neurotransmitters and neurodevelopmentally supportive hormones, which are responsible for various advantages. And that embrace, which in English we just mention it as skin to skin touch. But in our languages, we have a better expression. It is a loving hug between the mother and baby. It is a whole body to body contact, not mere skin to skin contact. And even at the international level, they have accepted this concept and allowed the different country people to use similar concepts for the interpretation of skin to skin contact. So it is a loving embrace or a loving hug between the mother and baby, which is responsible for the analgesic effect, sedation effect, improving the breast milk secretion, less cry, anti-inflammatory, anti-immunity effect, and so on. But the most important part here is this oxytocin is maximally produced when the baby is on mother's chest. That skin to skin contact, and that is why we use the word embrace. That is much more useful than the skin to skin contact, say mother and baby on the chin, or while breastfeeding, the mother's tummy and baby's tummy touch each other, or when the mother is holding on the cradle position, even the mother's thighs can attach. All that do not give that much effect only the oxytocin producing hormones are much more on the mother's chest, and that is why we say mother's chest is the best place for the embrace. Next. So having explained this, I'll just say that mother's body is biologically the normal place for the care of the babies. Next. Next. So, Kangaroo Mother Care Foundation, I will take only 5 more minutes. So, Kangaroo Mother Care Foundation has right from the beginning adopted the slogan that mother's chest is the best place for the newborn, mother's milk is the best food for the newborn, even for the preterm and small babies also, even in cesarean born babies also, mother's milk should be tried. And zero separation of mother and her baby is one of the best approaches. And I'm happy to note that all our statements are now ratified by even national and international agencies, and they have also included them in their official recommendations recently. And KMC should become a part of the routine care for all the newborns, including the mature babies. Mature babies at the most may require for 1 or 2 days only. But even in those 1 or 2 days, a lot of advantages are there. And of course, for preterm and small for babies, it must be given. Next. The same statement has now been ratified by Dr. UV Ewald. He is from Sweden, one of the pioneering institutes in promoting kangaroo mother care for very preterm babies. The new place for care for the premature infant is the chest of his or her parents. So skin to skin contact on mother's chest. And that is why we use the word embrace or loving hug. Next. And the same thing, KMC has a lot of role in neuroprotection, neurodevelopment. And now even after 20 years study also, they have proved the same thing, that the effects last longer. Next. And how we can achieve zero separation in our clinical practice. Let us see quickly what are the things we can do. Next. So, first and foremost thing, soon after birth, even before cutting the cord, the baby has to be put on the mother's abdomen first because of the cord length doesn't permit. And as soon as delayed cord cutting is achieved, a quick drying is achieved, you shift the baby on mother's chest. Term babies will seek out breast milk on their own, so breast fall will be achieved. Even near-term babies also will achieve that. Very small babies may require some help. But immediate skin-to-skin contact, even for the sick and small babies, as long as possible, unless immediate, urgent, advanced resuscitation or any other life-saving measure is required, immediate skin-to-skin contact in birth. Next. And it has got so many benefits. First of all, early mother-baby bonding. Mother is calmer, baby is relaxed, less cry, regulates body temperature, reduces hypoglycemia, improves oxygen level, early stabilization of heart rate and respirations, even in the normal baby, less release of cortisol and stress hormone, and all the help to improve quality of breastfeeding. And there are, of course, many benefits to mothers also. Next. And the same thing, how it helps in the breast milk secretion and breastfeeding. That is also mentioned here. I am quickly passing. And it lays a strong foundation for early child development. That has to be remembered. And better cognitive and neurodevelopment, behavior, and IQ. So it not only improves the breast milk, quality of breast milk feeding, but it also lays down a strong foundation for early child development and many other advantages, neurodevelopment. Next. So why promote? I have already given the justification. I need not repeat again. It is a biologically normal thing and we must attempt now in our NICUs. Every day we must take one special audit round to find out how best we could have kept this baby with the mother. What was our justification for separating the baby? And early stabilization, stress removal, all that I have already said. Next. So whenever the baby is on mother's chest, baby feels safe, their body also calms, brain also calms, Baby gets the reassuring, familiar heartbeat of the mother, which it was used to even in the intrauterine life. And subsequently, mother can talk to the baby, mother can stimulate the baby, a reassuring voice is there, and so many advantages are there which I have read. So even, and now WHO has said, even the sick and very small babies also, immediate kangaroo mother care can be given. And they have said, by not waiting for stabilizing the baby and then starting kangaroo care, you will be saving another 150,000 babies, because the maximum mortality and morbidities occur even before stabilization. So this is also ratified now, and it has come in the legal recommendations. Next. So early skin to skin contact and the early breastfeeding, it stimulates multimodal stimulation. All the sensations are stimulated, and it stimulates the synaptogenesis strengthening and naturally the long-term brain growth. Next. Even in the COVID time also, we should have done that. And one of KMC Foundation, one of the earliest to bring out the recommendation that mother-baby separation is much more beneficial than separation. Means mother-baby zero separation is much more beneficial even in the COVID time. Next. So I won't go through those things. Next. So zero separation is very good almost in all situations. There are very few exceptions. Next. Next. And how to achieve, all of us, we know even during COVID time, you observe all the precautions, but don't separate the baby from the mother. Next. Hand washing and other precautions to be observed. Next. And recently in 2015, they have developed a neuroprotective NSU program, We Care program. There they have mentioned 7 core measures. A healing environment to be provided, partnering with the families, that is family participatory care, allow the mother to be with the baby even in the NICUs, then proper positioning and handling, safeguarding the sleep, minimizing stress and pain, protecting skin, and optimizing nutrition. All these basic 7 core measures can be achieved by kangaroo mother care. Next. Benefits, I don't have to say. Benefits to the baby. Next. Benefits to the mother. Next. Benefits to the family. Next. Benefits to the community. Next. Benefits to the hospital. Even for the hospital also, there are several benefits. It saves on medicine, oxygen, nursing care, and ultimately on the expenditures. And most important thing is you're preparing the mother under your supervision and guidance so that she can take the same quality of care even after going home. So you are enabling her for planned early discharge and continued care at home. So the continued morbidities which we find after they go home, they are very, very minimal now. So these are all many benefits achieved. Next. And naturally, nations gets benefit by getting a healthier, intelligent newborn, and burden on the health resources are minimized, and it can be used not only in the facilities or hospitals, but even in the remote areas, even in the tribal areas, urban slums, everywhere. Next. So there are so many benefits and neuroprotection. This is just a summary. Next, how we can achieve that. So you should prepare guidelines for promoting standards of developmental care. So first thing they have mentioned is do not separate mother and her baby. Minimize separation and put the baby in KMC as much as possible. Establish a family-centered approach and so on. Next. Minimize the number of caregivers, cluster care, all that we have said, and give proper facilities for the mothers so that they can stay in your hospital for a longer time without worrying much, and they need not ask for the early transfer. And that includes even the behavior of the staff also with the parents. That is also an equally important factor, along with, of course, facility of toilet, food, and other things. Next. So you stabilize the baby on mother's chest. Next, even in the cesarean cases also you should promote. For that we request the cooperation from the obstetricians and the anesthetists and our nurses and family helpers. We have to establish a system. Now gradually we are convincing our obstetric colleagues for that. Some of them have already started it. Next. And even the twins with oxygen therapy also can be given KMC. Next. Even this is happening in Ahmedabad and other places also now. Next. Even mechanical ventilation also we can give KMC. It is reduces the days required for mechanical ventilation, reduces the requirement of oxygen, reduces the incidence of apneic attacks. So now even in India now people have started trying this. Next, earlier people were afraid, but once they are trying, they find it very useful. And all the painful procedures can be done keeping the baby on mother's chest, mother or father's chest, any surrogate's chest. Next. And breast milk production is much more when you keep the baby on mother's chest and then pump out milk. Next. And even when mild to moderately painful procedures, when you want to do, offer KMC to the baby. In that case, you should put the baby on KMC for at least minimum 15 minutes continuously, and then you do the painful procedure. Now, the same thing I request you to adopt for even vitamin K injections. Put the baby on mother's chest soon after birth. At least keep it there for 10 or 15 minutes or half an hour. And before removing the baby from there, you give vitamin K injection. One more thing I forgot to tell. When you keep the baby on mother's chest in the labor room itself, soon after delivery, it should be kept there for at least 1 hour, minimum. And in preterm babies, it can be extended even for 2 hours. Weight can, we need not hurry up for weight and other measures. Of course, life-saving thing have the priorities. Otherwise, keep the baby on mother's chest at least continuously for minimum of 1 hour. That is the message. And during that time itself, you can give vitamin K. Identity tag you can give there. You can, the breast milk feeding initiates there. Only thing is taking the weight of the baby, it can weigh. And soon after 1 hour or 2 hours, you can take the baby. We are talking about very small babies where the weight matters. In that case, with the clothes, you put the baby on the weighing scale and then just remove the baby and shift them in other clothing so that the baby is not unnecessarily exposed and not directly exposed on the weighing scales, thereby minimizing the chances of hypothermia and also chances of infections. Even the during transport also you should transport the baby in KMC position. This is one thing now we are strongly recommending, and we have now started training even the 108 emergency management technicians also. And same thing should happen, whether the baby is born in a private or public hospital. When the baby is being discharged, it should be discharged in KMC position, and the mother and the relatives should be encouraged to bring the baby back for follow-up also in the same position. And that is also another chance of minimizing the baby mother separation. Next. So think of all possible situation in your setup, depending on your expertise, your staff availability, and safety of the baby on the top priority. So take an audit how you can minimize it, and it is a huge disservice to mothers when their babies are separated from them. Next. So clinical application, the same thing I said. So think of all those things. First you have, and for to convince ourselves, first our training should be good, our conviction should be there, our competence should be there, our compliance should be there. Then we will convince our parents, and then we will motivate them with proper explanation. So proper counseling is needed and good quality training is needed. Next. And now we are trying to bring a paradigm shift. Earlier we started kangaroo mother care. because not enough incubators are available. But now we want to use incubator or warmer only when kangaroo mother care is not possible. So that audit we should take. So please reduce the agony of our mothers and their loving babies by separating them. One of our senior member from Vietnam put it in a very nice way. By separating the babies from their mothers, you are putting them in jail. You are putting them in scheduled feeding, you are separating them from mothers, you are not allowing them for their emotional satisfaction and so on. So that should not happen. And I plead with everyone, please try to understand these concepts, take them seriously, and change your protocols. Thank you very much once again for giving me this opportunity. And as all of you know, in BFHA also, KMC has been now officially included, and we are now trying to develop 10 steps for successful kangaroo mother care on the same analogy as 10 steps for successful breastfeeding. Thank you.
Jatin? Jatin, are you there?
Yes, ma'am.
Yes. You can conclude.
Yes, it was indeed a great session, ma'am. Most important thing is sensitization of doctor. As a doctor, we need to accept in a private setup, especially that we can do this. That is how we can start, and we should move ahead. And definitely, we all know that only simple touch of our mother also helps us, even in most tremendous stress or any of the illnesses. So that should be the topmost priority for sick babies. Thanks a lot. Thank you very much, ma'am, for the excellent talk. And I'm handing over to the Kunal now. Can conclude now.
Yes. Uh, Thank you so much, Sashi ma'am. As we had in the beginning, I had said, and now you yourself have proven that you are actually the mother of KMC. You have such a vast experience in the field of KMC, and you have brought the paradigm shift that from when warmers were not available, then KMC was given to the point where now, if the KMC is not available, then only warmer should be used. So you are the reason why this huge paradigm shift has come. I know you because my father always used to praise you. My father is also a pediatrician and student of yours, and he also used to talk so high of you. So thank you so much, ma'am, for this enlightening talk and giving a great start to this month with your KMC enlightening lecture. Uh, Thank you, Shwetal ma'am, for being there throughout. Thank you, Jatin, for excellently moderating this session, and thank you, ClearNet, for the seamless experience. There are no questions in the chat box, so we can conclude now. Thank you so much.
Thank you so much. Thank you.
Thank you very much for giving me this opportunity. Thank you.
Thank you.
No. Ma'am, we are obliged. You immediately you accepted the invitation. And then if Gujarat is your own organization, as you said, and we are really obliged to have you on the platform of Neonatal Pathshala. Thank you, ma'am. Thank you.
Ritu, you can stop the meeting.
Thank you. Yes, sir. Thank you for the opportunity. And thank you everyone for sharing such valuable insights. I hope you had a seamless experience. And thank you once again for extending us the opportunity to host the session. And looking forward to host you again very soon. Thank you, ma'am and sir. So with all your permission, everyone, we are signing off for today. Take
Yes.
care. Goodbye.